All right, man.
Big
End of the week.
It's been a big week this week.
Yes, it has. Jumpstart Health Summit, second time we've done it, and much better than the first one, I think. Long week, man. Long week.
Yeah, I mean, it started Sunday, and we're just gone through Good Friday.
Let's talk a little bit about what you did. So you started on Sunday with a workshop with 4 founders from Jumpstart Foundry working on building out AI with a friend of the firm. Tell us a little bit about that.
That's right. So, I mean, everyone is talking about, excited about vibe coding, and I am too. I've been doing it, but when you're building in healthcare, there's HIPAA, there's SOC 2, and then there's also just this concept that the code needs to be properly documented, fit into the overall code base, and be able to be supported. And so I've been resisting sort of encouraging vibe coding. And we found a great instructor, Teddy Kim, who built a system of 7 agents for the banking industry that we kind of converted to healthcare. And you get all the power of vibe coding where someone who didn't do software before can spin up a product. And yet it's in GitHub and it's commented with proper reviews, and then you merge the PRs, and sort of more of a normal process, even though you're getting that speed.
Right. So it's not like a lovable app.
That's right. Yeah, exactly. And I think that's important when we go to actually use these tools, or we go to exit a company. I need it to be sort of proper software.
Yeah, that's right.
And so we had 4 founders kind of do this test run. 3 had never coded ever before. Didn't know what the terminal was.
What about the 4th?
The 4th is an experienced full stack developer.
It's a great room.
Yeah, so it was a great test, really. And the plan was bring a PRD, so if the audience doesn't know, maybe it's like a Word document describing exactly what you wanted to do in as much detail as possible. And they brought that Sunday afternoon. Teddy taught them about how to use his tool, which is phenomenal. And they were coding maybe in an hour and a half. They were actually producing usable software. And I was hopeful that they'd get kind of meaningful progress on their product and then have enough momentum they could go home and keep going. And by Monday morning, they had all finished their MVP, which was incredible and unexpected. And so we decided to escalate and got together, and they all are going to raise money because they're founders.
Sure.
And so they wanted to build an investment bank because they want that support, that sort of advice on how's my pitch doing, and then also who should I talk to, make introductions. And so in the second day, we did a group project where we all collaborated, which was a different thing to have to be able to work with our own project has to fit into what you're working on. And we built an entire investment bank using this thing called Paperclip. There's no humans that are needed. It's a full agentic investment bank, but here, targeted at our space. So health tech, kind of seed or A rounds. And it's working now. So the other portfolio companies can use it. It was incredible to see people come in with really no background in software, then leave not only with their product, but also with the confidence that we can do this and even bigger projects. So it's really, really fun to see.
And Teddy was there with his platform, but Paperclip is open source, right?
That's right. So we taught the 4, and I got to learn, how do you go on to GitHub, clone a repo, is that what's called? Clone a repo. So we clone Paperclip. Paperclip is designed it's the infrastructure that a no human business or organization would run on. So first of all, it's incredible to be saying those words.
Right, I was about to say.
and then we put it in the product, and it's working now. The agents talk to each other, and they go do work and come back with advice to the founder on change your pitch deck in this way. And then we did it where it's pulling all of the deals from the last 365 days. And so you're getting real comparisons on, what did VCs or family offices invest in, at what terms. I think it's we will see, but it seems like really, really could be helpful.
That's remarkable. So
that was before the summit.
That was before the summit, right. Yes. Okay. And then we had the summit itself. We were blessed with another summit with great weather. So that's always great. Right. Geodis Park is a fantastic setting to do the event in. So thanks to Nashville Soccer Club for allowing us to use the venue.
Yeah.
Man, what a great day. What a great day.
It was a great day. I mean, we started with Chris Boone from Oracle. as our guest. It probably is dropping around the same time as this show. So maybe the audience has heard it first. Maybe they'll hear it next. And he did a great job sort of explaining Oracle's move into real-world evidence. And really, they have a lot of ambitions to cure many diseases, which is ambitious but super exciting.
Yeah.
Too.
And look, I mean, they're ridiculously well-positioned.
Yeah.
And they are adjusting what they are doing, right? I mean, the news that hit this last week, I mean, obviously the layoffs are one thing, but I think also, and he addresses it in the conversation that's in the podcast, but I think it's what they're doing it for, right? It's the build out of data centers to sort of meet the moment. I mean, this is the moment, right? This is it. Like this is, you got to get your stack together to be able to evolve your company into the next phase. And he talks about change management, some of the things they're doing internally, or not just that, but like changing how they operate as well.
Yeah. And I think that it's really valuable to have Larry Ellison. I mean, Oracle's still a founder-led organization, even after 30 years.
That's an important point.
Yeah.
It's an important point.
You know, that organization can move much more quickly than one that doesn't have a founder with that kind of foresight and vision and governance power.
Right, right. And then we moved into the fireside chat part of the event. Dave Johnson from Foresight Health, Ann Jordan from the Healthcare Finance Management Association, Edmondo Robinson from Down East Digital, Mohit Bansali from Equitify, and Derek Brown from Birthday Labs. So just, you know, like an incredible lineup covering healthcare, but also capital markets, and also the intersection of AI and, you know, crypto and founding companies, dysfunction in the market. I mean, we hit it all. It was great.
I mean, we really covered sort of what is changing in healthcare right now at a level of detail that was very inclusive, like all the different pieces. But I want to take a step back. You're too modest maybe to talk about it, but I opened the summit with an announcement that I was super excited to make, which is you're going to step in as CEO of Jumpstart Health, of course, still running Jumpstart Novo too.
Of course. Yeah.
And freeing up my time to really kind of lean into the Foundry work, which is in this time, I think, going to be really impactful. I mean, those kind of 1, 2, 3-person teams can really take advantage of the AI moment, especially if we lean in and help them. Yeah. And so we made that change, which I'm super excited about. I think it really kind of set the tone for the day as well.
Yeah, I think when we made the decision, how many ever months ago, that this was something we wanted to do, I think we made the decision for different reasons. It was more like, hey, it's succession, but not like you're out of the company, just like, hey, you've done it for 10 years, basically.
Right.
You know what I mean?
It's healthy to have some new perspectives and let you run and
Exactly. But now it's interesting, right? Like looking at the actual week of the summit and looking at what you did with Foundry, it's a little more like having you focus on the whole reason this whole Jumpstart Health thing exists in the first place, which is Foundry, which was your initial idea that VC is being disrupted by technology, and now you don't have any barriers between you and the technology, right? So you're actually ahead of me in terms of like hours spent in AI. You've built more agents. I have the background as a developer, but you've spent more time doing that. And at the same time, I think interestingly, it's also time for venture firms to evolve with technology. And that feels like a space where I can be really helpful from an architecture perspective, right? Like really looking at where are the opportunities to leverage our data that we've developed over a decade across 49 different entities that we manage, and hundreds of portfolio companies, hundreds of limited partners, and now the advances that tokenization and the evolution of the private markets are going to bring in the future years. It feels like we're both in the right seats to advance the firm, collectively, like still every day doing what we always do together, but also like putting everybody in the right seat.
Yeah, definitely. And I think the summit really showed off how you can bring in different points of view to really evolve Jumpstart Health to meet this moment in the market, which is super exciting. And I get to play more, which I like.
No, it's good. And I think it was also a great example of the value that the practice of Health Further has how it's evolved our thinking and how we can cohesively take the evolution of that thinking and put it into investment thesis, put it into an agenda for an event, right? I mean, like you said, the cross-sectionality is really the thing, right? Because we can come up with unique views that are our own because we're studying all these things and we're doing it in a practice every single week.
Yeah, that's right. I mean, it's been 2 years, maybe 2.5 years of every week going through all the applicable news. And I think that puts us in a place where we have a pretty good understanding of the overall market context. So a new piece of news drops, we can immediately put it into our frameworks. And I think we showed that off at the summit, sort of how it all fits together in a really interesting way.
So there will be podcasts coming from the summit. We're going to start with our conversation with Chris Boone, who's the Group Vice President of Research Services at Oracle, but we've got 5 more that I think we'll get approval to, release all 5, which will be great. We might even put out maybe part of my talk as an episode or something like that. We'll see.
Yeah.
Look, excited for everybody who came out and for everybody who was invited and wasn't able to make it. We missed you, but next year, I don't think you want to, miss the summit. So with that, it's also been a heavy news of week and a lot to cover. So why don't we now dig in? Let's start with the economy, and nothing new here. U.S. job openings and hiring fell in February. The available positions fell to 6.9 million, down from an upwardly revised 7.2 million in January. This is the Wall Street Journal. Vic, it's just durable, and it's our reality. And again, I think one of the things that we talk a lot about, the practice that you and I have in terms of sitting here having this conversation. We always pull largely from mainstream media, I think, because it's referenceable for our audience, right? When we say Wall Street Journal, New York Times, right? But like you and I are not getting all of our information from these sources, right? We are ourselves listening to a series of podcasts, right? That forms our direction on where this is all going. And those podcasts, like what people are like trying to figure out, where are we going with universal basic income? Is that even going to work? Right? Like, what are we going? Should kids even go to medical school anymore? Like the conversations are very far out, very far out. I would say far out in advance of most, not all, but most of our audience.
Yeah.
I guess I just want to say that this is clearly the future, and we are going to have to start talking about it. We're going to really talking about it, because in a year's time, if this continues, there's going to be some real society. I mean, I hear way more about layoffs than I hear about hirings. Like way more. No question. Yeah. Way more, right? And then you hear about people who they were laid off and then they can't get the next gig.
Right.
And I just don't see how this is not going to, at some point, start to erode our society.
Yeah, no question. I mean, I think the part of the reason we, especially for the economy segment of the show, which we're, starting off with, we always start off with, the sources, at least right now, are the establishment. I mean, they're mostly from the Federal Reserve Bank or its subsidiary, different reporting entities, or BLS or some. And as I've talked about other shows, the actual quality of the data is pretty poor.
Right.
But there's nothing else. So why are you looking for your keys here if you lost it way over there? Well, the light's here. And
right.
That's all we have. And I think the results are indicative of where I think the economy's going. But there's more downside risk than upside, I would say.
Yeah, agree. So I feel like a lot of times I'm having conversations with people about artificial intelligence, and we're a little bit in this place where, if you acknowledge what is actually happening, some people will just say, hey, don't be doom and gloom. Like, what about we're going to cure cancer or all these other kind of things?
Yeah.
And I'm like, totally. But also don't have your head in the sand about the fact that you are creating a new situation. Let's just call it a situation. I call it a problem.
Yeah.
You're creating a new situation that you have to address, right? That you have to have some type of solution for. And not talking about it is not helpful, I don't think.
Yeah.
Right?
Yeah, I think it's strange because on an individual basis, I think AI and the various kind of offshoots of AI are empowering individuals. If you want to spend, say, even an hour a day learning, you can ask the models directly, teach me how to do whatever. And they're pretty good at teaching that.
Sure.
So for an individual who is curious and motivated and wants to learn, it's never been a better time to like pull yourself up and learn new things.
Sure.
And yet the organizational sort of structures where you go to college and then you get a job and that job teaches you a career that you are in for maybe not your whole career, but 10 years, 5, 10, 15 years. That is at least changing. I don't know how it's changing, but it's changing. And so it's this weird thing where people are getting more autonomy, more power to pull themselves up, but all the systems we've relied on, just like, generally called the American way, work hard, do the right thing, and you'll sort of pull yourself up to middle class at least. That's at least fraying or maybe no longer that plausible.
Yeah, and by the way, it's not just layoffs, right? The headline here is job openings fell, right? I mean, it's demonstrably true that for certain degrees, the placements have fallen off a complete cliff.
Yeah.
Computer science is just the first, right? But more will come.
Yeah.
More will come.
So my son came home for Easter. So I was talking to him. He's a junior in college.
Mm-hmm.
So he's got a bunch of buddies that are really actively, seniors that are trying to find jobs. And it's hard. At least at Tulane, it's hard. And I was saying to him last night, Jumpstart used to hire 4 to 8 interns a year. And then a few of those we brought on full time.
Yes.
And we don't do that anymore because the management of them and the onboarding and all of the work to give them a kind of a good experience is the same level of difficulty, but then I can get the same results very quickly with automation, with AI agents, and I don't necessarily need lots of other people helping with these kind of, important to do, but not that difficult projects.
Yes, agree. Specifically talking about what we did, it's like we made the time investment worth it. Look at who those people were, right? It was Eller Malchuk, who is now the chief investment officer at LaunchTN.
Right.
It was Zach Terry, who is now like a principal architect at, at a big Salesforce and HubSpot. And these are basically like their first jobs outside of Jumpstart. So, you know what I mean? So like, it's like they came in as interns and then they worked with us and now they are like leaders in the industry. So that investment made sense, but now it's like, are we going to do that every single year? I don't know that we're going to do that every single year, right?
Yeah, maybe we should do it for the good of society, but it's not good for doesn't really move Jumpstart work forward like it did previously.
Yes, exactly. All right, next story. So we had a rough quarter.
Yeah, Q1's finished and the stock market was difficult.
Yeah, so what went up? Energy. Energy was up 35%. That's...
it's good if you own Exxon, but if you're in the overall economy, energy prices going up is good for the energy stocks, but not good overall.
Right. The next biggest performing sector was less than 10% up, and that's materials, then utilities, industrials, real estate. The S&P 500 was down about 5%, healthcare down about 6%, and everything else, IT down almost 10%. Yeah. Not a great quarter, not a month, not a great quarter, right? So. Right. That is certainly not the trend we have been used to over the course of the last 5 years back to back.
Yeah. I think no one was expecting a war of the length and duration that we're experiencing right now. So
yeah. And then finally, private credit. The private credit situation, Blue Owl, is really looking pretty scary.
Right.
But this article here from the Wall Street Journal headlines, what banks stand to lose from the private credit mess. The names that you hear when you talk about private credit are not JP Morgan, Wells Fargo, Bank of America. But if you look under the hood of the names that you do hear, that's where they live, right?
Right. Yeah, that's why this story was, it was eye-opening to me. For, 9 months, we've been following the private credit story. And I thought before this article that the reason the private credit market had gotten large is because the banks pulled back from making those kind of like maybe mezzanine or maybe not prime loans, but like one tier more risky. after the great financial crisis, a lot more regulations. The banks pulled back from that. And my understanding before this article is that private money, institutions, maybe rich individuals, stepped into that and were taking risk for the returns. And so I was watching it because it seems like there's going to be some credit problems.
Yep.
But I didn't think the kind of systemically important banks were really involved. That was the whole reason it got created.
Right.
And it turns out the Wall Street Journal did some good background research. The banks they're making loans and providing capital to then these pools of private credit. And so it's really not that different. JP Morgan Chase is the largest, and I don't have the facts, but they were pretty large in the great financial crisis too. And so it really hasn't solved the problem. We just have sort of renamed it private credit. But if there's big issues in there, it's going to come back to these banks, and we'll have the same contagion sort of issues that we've had in the past.
Well, what happens when you don't actually have to suffer consequences for your behavior? You don't change the behavior.
Right.
You know what I mean?
Yeah.
And look, these banks are not banks, right? They're the arms and legs of the Federal Reserve.
Yeah. That's right. They're so big that they're quasi-government entities. And, I think the incentive structures on Wall Street were bad in the great financial crisis. Like, I'm going to do this subprime housing package. I'll get my commission, my year bonus this year. And then if something happens, that'll be a future year. And so everyone made that rational decision, like it's good for me or good for my bank group or whatever. But then the risk kind of aggregates. And when it comes due, there's no one there except the federal government. And I think we have the same thing kind of percolating again. Maybe we won't have a problem, but I want to keep watching this because it's getting bigger.
I mean, if history tells us anything, this is a bad situation, right? And also, I mean, I think a lot of the private credit is pretty aligned with the public markets.
Yes.
Right. Isn't that right to say?
Yeah, that's right.
Right.
Yeah.
I mean, it's the same underlying thesis of like why it's going to do well, why it's going to return. It's ultimately in equities. It's in businesses.
Yeah. Yeah. Definitely. And the worry, at least on my end, is that in 2008, we had a lot less government debt. And so if there is a problem in private credit that escalates to these large banks, the government, I think, will have to step in. But and they will, but we're already at 120% of GDP.
Right.
And we weren't there in 7, 8, 9. And so there was more capacity to help.
Yeah.
So,
all right, let's move to VC deals. Got to start with the biggest one. Whoop secures almost $600 million, $575 million in funding. This is a $10 billion valuation. Just tremendous company, tremendous brand. I was having lunch with my buddy Chris Redditch today, and he was like, "Man, I never take this thing off."
Yeah.
Like it's constantly feeding in data and insight to him, right?
Yeah, I mean, they've raised almost $1 billion. So they had raised something like $400 million, and they just added $575.
Yeah.
And it's a big company now, but it's private. And I think they're just them and Aura and Garmin and all these Apple Watch, these wearables that we used to think were less quality and maybe not toys, but for personal use only.
Sure.
Have been elevated now by the Trump administration and the Kennedy HHS. And I think for good reason. It really is helpful, whether it's medically grade measurements or not. The frequency is just much better. I mean, you're getting readings all day long, as opposed to once a year I go into the doctor and they do my blood pressure, but it's not the same environment I'm in. So my blood pressure is higher than normal anyway. And so I think getting this lower fidelity readings, but much more frequency, has a lot of value in healthcare.
100% agree. Yeah. So I for one think this is great, and I also think it's another company that is now at a $10 billion valuation, right? So we could call that market cap.
Yeah.
That is not public.
Right.
All right.
Yeah.
I mean, all of the value is being created in the private markets.
Yeah, that's right. And it's because starting with Sarbanes-Oxley and a bunch of other things, it's gotten really hard to be a public company, and the value's not that useful.
Yeah, and you're going to get dragged down. We just went through what the last quarter was.
Yeah,
even if Whoop is blowing it out, they're going to get dragged down by that.
Yes.
Right.
That's right.
All right. Switching over to policy, the Justice Department is filing antitrust lawsuits focusing on prominent hospital systems contracts with insurers. And the first one is with New York-Presbyterian. What's going on here?
This is an interesting story. The Justice Department is claiming that New York-Presbyterian used its leverage to drive contract negotiations, higher prices from insurers, by using assets that it has that New Yorkers need. So it might be like a NICU or a burn unit or something that not every hospital has.
Right.
And that is not allowed. That's true, and it's been going on forever.
That's been going on forever.
That's just that. I think, listen, it's hard to negotiate with insurers. Health systems use every asset they can find to use, because they need to bring in enough revenue to survive. And so it's an interesting, I think DOJ is trying to make an example of one of the best known health systems in the world, in the country. And I think they probably have the evidence on their side. But it is also the way we have funded a lot of these units. We don't reimburse enough to run a burn unit or, various things, ED. And so there's been this kind of like, I don't know, wink and a nod, like that's fine. Let's just like try to get the whole system taking care of the population that we need. And DOJ wants to change that, which is fine. But then how we're going to fund those units, I don't know that. So it's a weird thing, because I think they're probably right, but the whole system relies on kind of the insurers and the health systems negotiating and getting to the best answer. And if the government steps in, we got to find some new way to pay for these things.
I take all of these things together, one big beautiful bill, price transparency, investigation, FTC, DOJ, and across the spectrum, right? It's not just providers, it's payers, it's pharma, everybody is getting it.
Ending the tax subsidies.
Ending the tax subsidies, and it just is, to me, the only analysis that I can come to is that the Trump administration and the Republican Party, because a lot of this stuff is also coming out of, House and Senate, has determined that the only way to reform healthcare is to break healthcare. Just break it, And I think which is such a shock to all of us, right, is that, you talk about how providers, the negotiations have always been difficult. I think healthcare as an industry has always used its high availability, necessity, the fact that, the stakes are very high. I think it's always used those things to fend off change, right? And to kind of say, you don't understand how this works. And I think they're just at a place where they have lost the ability to do that. You can only do that so long, right? But at the same time, we've watched them do it for so long that now that it's not happening and the industry is just being broken, it's shocking to watch.
Yeah.
Right. Because there was always some truth to them saying that. There was always some truth to, man, this is going to result in less access to care. This is going to result in P&Ls going upside down. This is going to result in facilities having to close. All that's true. All of that is true. And I think the Trump administration and Republican Party have decided that's what it's going to take. That's what it looks like to me.
Yeah, I think that's right. I think it is true that if you change the system like this, there will be people that don't get access to the same care they could have gotten, say, 5 years ago. And that will lead to poor health outcomes for those people. And it might even, I think a lot of people would say, I probably agree with it, depends on the case, it might even lead to more money spent in like a 10-year view because you don't get preventative things. And at the same time, I think the other side says, well, it's been 50 years. Like, we have to fix this at some point. And yes, there might be, say, collateral damage, or there might be a time when it's not as good as it could be, but we have to go through this time to get to a great other side. And neither side's right or wrong. It's just different points of view, but it's going to be, let's say, bumpy. It's going to be a challenge to work through.
I mean, that certainly rhymes with what President Trump is saying about Iran.
Yeah.
Moving on, UnitedHealthcare launches Avery, generative AI companion for members. UnitedHealthcare, or really United Health Group, is on a little bit of a run here, announcing new AI products that they are rolling out. I've said for a while, UHG is very unique amongst all healthcare companies in terms of their internal headcount around technology. They have a very, very robust technology capability. Their data asset is really kind of second to none in the industry. They are now using that capability, I think, in a way that is appearing to be moving the industry forward, right? Which to me feels like it's part of a larger playbook to turn the brand sentiment around. Hey, look at this thing that we're doing that's advantageous for members. Hey, look at this thing that we're offering to the entire industry around prior auth, and it's a capability not just for us. We're offering it through Optum Insight to everybody, right? Like it looks like they're now taking that technical capability that they've had for quite a while, and now turning it to be a good actor in the industry in a way that really only they can do because only they have that kind of capability.
Yeah, no question. I mean, they are constantly under attack to be broken up. I mean, there's people in the Senate and the House trying to create a bill to do that. We haven't covered it because it hasn't gotten that much traction. But I think you're right. They're trying to showcase, it's obvious they're big, but we can use this scale to bring things that really help people. And, and an AI companion to help navigate what my EOB means and how to go about this. What does coinsurance mean? Why am I getting a bill that I thought I didn't have to pay? My deductible's finished now. All those questions, I think, will be much better answered with a patient agent that can, you're not on hold forever trying to talk to someone. So it's great. This one particular story is great. And then I agree, they're trying to turn around the sort of PR campaign.
Yeah, they've got a drumbeat going. Okay. Intuition Robotics secures Medicaid coverage for social AI robot ElliQ in Washington State. I'll let you run this one down because you've got a portfolio company that is in this space.
Yeah. So I invested in a Alzheimer's diagnosis and treatment company called Together. ElliQ was the competitor we were looking at last fall. And they do more than that. It's a companion for seniors because Alzheimer's and dementia is a big aspect of that. So they were able to get reimbursement in Medicaid for the entire state of Washington, which I think is great. Seniors in the state of Washington, it's maybe go down a little bit. There's a picture. There's a physical device. It kind of looks like a little bedside lamp, maybe.
Yeah.
It's not totally a face, but it's a face-like thing, and then a screen, like a little, maybe an iPad, slightly smaller than an iPad. I think it's great. I also think our product will be better. I'm not sure you need the little face-like thing in a physical device, because if you're in a different room, you might have your phone with you, but you're not carrying that device around. But despite the competitive tendency of me to, say ours will be better, we're not live yet. They're in Washington State, and they can bring it to seniors. It's reimbursed. And there's a lot of loneliness. There's a lot of activities of daily living that seniors need help with that these tools can be really helpful for. So I think it's great that we're reimbursing it.
Yeah. A couple of things about this. One, I was in this morning, I gave my talk at the summit to a group with the National Healthcare Council. They've got a group of I would call them emerging professionals, who are taking a foundations 2-day class. They have Michael Burcham and Paul Keckley. So, some really strong folks, John Graves. And I was there this morning to kind of talk about the investor's perspective, innovation. And there was a bit of a ethics discussion, around whether or not it's good or not to be engaging directly with technology as if it's a sentient being. You know what I mean? And I think it's a very, very rich conversation to have, but I don't think that there is a cut and dry black and white answer to it, right? So obviously, on one hand, AI psychosis or, people who are being, convinced to do self-harm, these are like really, really damaging, terrible things. And at the same time, loneliness is very, very real, right? And the idea of just telling people to get out there or whatever, it does not, has not solved it.
Yeah.
Right? Has not solved it. We have not figured that out, right? We have bigger societal issues that are, causing fractures in our ability to be there for each other. And so I think the reality is, for some segment of the population, communicating with one of these AI, I don't know what you call it, but products. How about that?
Yeah.
Communicating with one of these AI products is going to actually improve mental well-being. I think it's interesting here. The little byline under the photo, it says, during a pilot program, participants engaged with ElliQ an average of 60 times per day, while 100% found ElliQ useful in improving wellness, and 95% of patients reported reduced loneliness. I mean, so it's like everything, right? There's going to be good stories and there's going to be bad stories, but I don't care what you say, we're moving in this direction.
Yeah, we're not going back to the 1950s, 60s, Leave It to Beaver, kind of time where like the seniors were part of the extended family. Everyone lived in the same town, in the same house, and they helped care for the kids, and then the grandkids were there and helping them. That's a wonderful time. Like Leave It to Beaver is a wonderful show, but that's not the reality we're in. Families have moved all over the place. My mom's in Minnesota. My dad's in 3 hours away in East Tennessee. I can't just check on them on my way home, and that's not reality for most people. So we need to utilize other tools that we've created. And are they perfect? No, but the good old days weren't perfect either. There are aspects of that weren't great.
That's right. Totally agree. All right. Now we're going to go back to back with stories about the strongest company in pharma, Eli Lilly, one of our LPs.
Yeah.
We are talking our own book for sure. So I don't know if that's a disclaimer or not, but I think they're awesome.
And they are just continuing. I mean, we'll go through these stories. I like the people at Lilly, but I'm not intentionally selecting stories just for that. They really are delivering.
No, listen, they're objectively the best company in pharma.
Yeah.
It's like not, that's just what it is. Right. So the first story is an acquisition, Eli Lilly to buy Centessa Pharmaceuticals for an initial $6.3 billion. The deal expands the drug maker's neuroscience portfolio and capabilities into sleep medicine. So what's the deal here?
Yes, sleep's a huge issue, and they are acquiring Centessa, who has assets in that space. I don't know the details of those drugs, but they're sort of all related to excessive daytime sleepiness, insomnia, things like that to help you get better sleep.
Yep. All right, second story. Eli Lilly gets a speedy approval for their GLP-1 pill following Novo Nordisk, and we knew this was going to happen. Yep. I will never forget when we first started talking about the GLP-1s, and you were like, the shot, okay, fine, but the pill is where it's at, and we're here now.
Yeah, and I think everyone, including me, have been surprised at the adoption of the shot. And it just shows how much demand there is for assistance.
Yes.
Changing your behavior, eating more healthily, losing some weight.
Isn't it amazing how normalized GLP-1s have become? Like people talk about them in public, and it's just like there's no shade, there's no shame. No, it's just like,
well, so many people are using them.
Yes. I actually think it's amazing. I think it's great that something like that has been able to just kind of bulldoze the shame cycle entirely. Like more of that, more of that.
Right.
And then the final story, probably our favorite, is that Eli Lilly reaches a $2.75 billion deal with Insilico, who they've been previously working with since 2023, to bring AI-developed drugs to the global market. And this is really about how AI is going to transform drug discovery.
Yeah. And it really fits well with Chris Boone's talk, I think, that, Lilly is bringing AI now into their pipeline, into this sort of creation of new drugs in partnership, but it's really going to accelerate what they can discover, what they can treat in a way that's, I think it's going to be great for everyone, including Lilly shareholders, but all of us as consumers as well.
Yeah. I mean, this is exciting. And also it's the foundational work that is going to lead to, I think, not just many more diseases getting appropriate treatments, but also I think some diseases just we're going to find cures for.
Yeah.
That's
right.
And that's the trend I'm really excited about is like not the treatment, the cure.
Yeah.
Right. The cure. Yeah. All right. So shifting into Web3, Fannie Mae is going to accept crypto-backed mortgages for the first time. I like the headline. I don't love the first sentence of this article. New offering from Better Home and Finance and Coinbase allows home buyers to pledge Bitcoin and other cryptocurrencies when making a down payment. Okay, we're going to circle back to like what this actually means, but I want to just read the first sentence, if that's okay, Vic?
Yeah.
Okay.
Is it in the Wall? You say the Wall Street Journal?
Yeah, Wall Street Journal. Yeah. Wall Street Journal. Yeah. So the headline says Fannie Mae to accept crypto-backed mortgages for the first time.
Yeah.
Okay, that's the story.
Right.
But then the first sentence goes, the mortgage finance giant Fannie Mae will soon accept so-called crypto-backed mortgages for the first time, the latest expansion of cryptocurrencies into mainstream financial transactions. Like, why do you need to put the so-called in there? I don't understand. Like, if it's crypto-backed, that's what it is.
Yeah.
It's crypto-backed.
I mean, we're not in 2012. Like, these securities are, first of all, I think they are clearly stores of value. You can sell them. If the mortgage doesn't, is not serviced, a bank can then sell the Bitcoin or ETH easier than they can sell the house by far.
Yes.
And so, there's no reason for the reporter to put in that kind of a little bit of like tossing shade at the crypto industry for no reason. I mean, Fannie Mae's accepting it, period. That's the story.
That's right. But I mean, it's just yet another proof point that crypto is being fully adopted into the institutional finance world, right? I mean, in this case, into the government, coverage part.
Yeah, I mean, there's a lot of homes that can only really be financed to most buyers through reselling to Fannie Mae. So it's a huge unlock to be able to also put your Bitcoin or ETH or whatever crypto you have in there.
Yeah, and look, another big win for Coinbase, and I think we have more to talk about on the Coinbase front, right? So second story here is Coinbase's AI payment system joins the Linux Foundation and gathers support from Google, Stripe, AWS, and others. So their X402 agentic commerce protocol that was really leveraging a nascent HTTP protocol. It was just waiting for someone to pick it up and do something with it. But it was always kind of there for the idea of micropayments.
Yeah.
It's amazing that, it's taken all this time. 1993 is when all these protocols were drafted. Right. And we're finally, 30 years later, finally making use of good old 402.
Yeah, it's amazing to me that they had the foresight to put that in there. And then it's been 30 years, and now we're ready for it.
Now we're ready. Yeah. Now we're ready. It only took 30 years, Meg. It only took 30 years. But really quickly, let's maybe just make sure we talk about agentic commerce and what that even means, right? Because we just used some buzzwords. Yeah. So why don't you talk about it? You're our AI expert.
Yeah. So we announced this week an AI agent that will be available for all of our Foundry members. So all of our portfolio companies. They probably have their own AI tools they're using that they've paid Anthropic or Google or someone for, but we are also offering an AI agent that can support them. And maybe it needs to, so we're offering that free, but maybe they want to use that agent to get a piece of data from a healthcare company, and the agent's going to need to get 10 lines of a database. They would be willing to pay half a cent for that. And right now, if you do a credit card payment, the credit card fees are going to be $3.95. So you're going to pay half a cent for the actual valuable thing, and then $3.95 or $2.95 for the processing fee.
Right.
That doesn't work. Like, you can't do payments under, say, $10 or $20. Just the payment rails don't scale down that low. They don't work. And 402 is designed, and Coinbase has sort of adopted that standard, then customized it to allow Faye, as our agent name, to be able to have a little wallet, and then maybe the founder gives Faye $5, and it can make a whole bunch of micropayments, half a cent here, a quarter cent there, 5 cents here. And there are then MCP servers and other groups that are providing those. And so you get like a little economy. People call it the agentic economy. You can call it whatever you want, but there's a set of transactions where both sides are happy. The seller is happy to get the half a cent because it's software and it doesn't cost them that much to deliver it. and the agent receiving the data is happy to pay it. That's kind of what's envisioned here. And it's beginning to go, but it's still early days.
I want to just pick up on one little thing you said that also is an important part of this, less on the agent side, more on the crypto side. You said half a cent. And it's important to note that we actually can't denominate in half cents in dollars.
Right, yeah.
But you can in crypto.
Yeah.
Right. We can fractionalize down many zero, decimal points in a way that you can't do with dollars. And so that's another reason why different crypto currencies might be a better use. Maybe you want to do sats, or maybe you want to do Solana Dust or whatever.
Yeah.
But you can get it down to a finer point that matches the value of the transaction. Whereas with dollars, a penny might be too much.
Yeah. Right. And I mean, it's important to enable all the different levels. Like, yes, there's going to be Fed wires of $10 million moving around,
which is Bitcoin.
And that can be Bitcoin. The Fed funds and Swift work fine too. But when you go small, there is no answer except this. So that's why people are focused on it now.
Right. And then Coinbase clears key regulatory hurdle in bid to bolster its stablecoin business. So wins all around for Coinbase. Mm-hmm. We kind of knew this was coming. It was weeks back when Donald Trump came out and clearly was behind the crypto industry and admonished the banks. And I think you kind of knew that was going to happen because the crypto industry got him elected, right? I mean, or at least was a huge supporter in getting him elected.
Yeah. I mean, whether you love Donald Trump or hate Donald Trump, there's not a lot of people in the middle. He really can read the zeitgeist of media and the country. I mean, he has a gift for that. He was smart to come to the Bitcoin. I mean, you talked about it in your talk. He came to Nashville to the Bitcoin conference, and I don't think any president or candidate had ever come to any kind of crypto conference. And there's a lot of Bitcoiners that have a lot of Bitcoin value. And so there were a lot of donations. A lot of people voted on that one issue. We've talked about it on here before. The Democrats, I'm not sure why they, shot themselves in the foot, but they did. And then, of course, Trump is also monetizing it through his family stuff. So there's a lot of reasons to think that the Trump administration is going to keep this kind of process going.
Yep. Agree. So strong week for Coinbase over what's been a strong year and a half, quite frankly, for them. All right, so kind of story of the week on the AI side, it has finally come out that there is a 2-person billion-dollar company, and they've been doing it very quietly, but the company's called MedV. The founder is a guy named Matthew Gallagher, is 41 years old, and he and I think his brother.
Yeah, that's right.
They took very little amount of money. They didn't raise any capital, and over the last year and a half have been leveraging AI to sell GLP-1s,
right?
And have built a ridiculously successful company that's worth $1.8 billion.
Yeah, and so the challenge or the prediction that kind of drove this story is Sam Altman, maybe 18 months ago, predicted that there'd be a company with only one employee that got to $1 billion in sales. This company has 2 people, but they're at $1.8 billion in revenue. It's adjacent to healthcare. It's healthcare. It's also kind of e-commerce healthcare, but
it's hims and hers. I mean, I think we'd call it healthcare.
Yeah.
Right. Or at least health and wellness. You and I would invest in it.
Yeah.
Right.
Yeah. And so it's a different world. And this guy invested $20,000 of his own money, and he doesn't disclose the margins, but I think they're probably pretty high. And the revenue is $1.8 billion.
It's ridiculous.
And so, I mean, it's just another sign that small companies, AI is empowering small single-person, 2-, 3-person teams.
And I think also it's a sign about where you are putting your time, right? And I think that was one of the lessons for me about your workshop this weekend, right? Mm-hmm. Is I think a lot of the reason why people are not doing it is because they're busy doing other things.
Yeah.
Right? And it's like, but when you can take 2 days and be in a room, you can come out on the other side with a product and a company.
Yeah.
And if you can take 2 months, what can you do? Right. But people's time is captured. Right. People are so time poor.
Yeah. I think it's time and habits. But then also, if you looked at the AI capabilities, say last summer, you took a weekend, I'm going to check this out. Vic and Mark keeps talking about it. And you look at it last July, it's changed like 5 times since then. And the capabilities they change every couple weeks.
Right. So, but I think the thing that's so interesting about this story is he didn't start at the Claude code explosion like everybody might have assumed. He's been doing it for a year and a half.
Right.
So on not very good AI, he and his brother got it started. Yeah. And I think that was kind of the point I was making. Yeah. It's like he made up for any shortcomings that the AI had by just spending more time on it.
Yeah. Yeah, that's right. And then as the AI gets better, you sort of get this tailwind where like, oh, I was having to do these workarounds, and now the agent just works.
That's right. That's right. All right, let's finish up the AI rundown. Let's start with Anthropic. So Anthropic had a big leak. Yeah. The Claude code base was leaked. Just kind of amazing that this happened, but also not so surprising because this is a company that's been launching a product every 8 hours. Right. And so at some point, something was going to get missed, right? And look, anyone who uses AI a lot knows you have to watch this stuff, right? You can't totally turn your eyes from the process. You can delegate many things to it, but at the end of the day, some checking is important and needed. And so Claude Code's base has been leaked out, and it's been all over the internet. Now, it wasn't the actual model, right? People need to understand it's the harness for Claude Code. It's how you interact with it on the terminal. But the result of it being leaked is that we now have Claw Code, which is out there, and people are using it. It's an open source version of Claude Code because once it's out there, that's it.
Yeah. So Anthropic is pursuing their copyright legal rights and trying to take it down. And a developer got up at 4 a.m. and saw this and quickly rewrote it with Claude Code, I think, using their own tool to basically transform it from, maybe it's in TypeScript, whatever it's into Python and Rust. And so now this is clean. There's no legal problems with using this code. It is 100% legal to use this version of Claw Code because it's written in a different language. And the way copyright works is it's actually each word, and of course in a different language it changes.
Yeah, and look, I mean, I think there was I'm trying to think what podcast I was listening to. I think it was Moonshots, and they were talking about how like IP is over. Like you just gotta give up on the whole IP thing because any of these AIs can reverse engineer and then recreate in a novel enough way to remove the IP protection. So that's not the moat now, right?
Yeah. I mean, I wrote a chapter in my book about this. I think IP is over. I mean, the example in the book was compact computer, re-engineered through a whole clean room process, the IBM BIOS like interface in the 80s, and it went to the Supreme Court. And they had to hire a team of engineers to document IBM's product. And then they took that paperwork and gave it to a new team of engineers to build the compact thing. And that handoff with like people that had not seen the actual IP was validated as legal. And what I talked about in the book is you can do that in a weekend now.
Yes.
With 2 people and an AI tool, because you can reverse engineer all these products very easily.
Yes.
And so I think that's one lesson. The other lesson that I'm trying to internalize is Anthropic, I think, is probably the best product company in AI in the world right now.
Yeah, I don't think there's any debate on that. I think that's universally.
If they can make a mistake, I think it was an internal AI mistake. Like it just left a door open that shouldn't have been left open. If Anthropic can make a mistake, ain't nobody safe. You need to be really cautious with this stuff.
That's right. Okay, Google announces Gemma 4 open AI models, and they switch to the Apache 2.0 license, and the crowd roars.
Yes.
So I'm, as an old school open source guy, started with LampStack. The A in LAMP stands for Apache. For anyone who doesn't even know what LampStack is, Linux, Apache, MySQL, PHP. The Apache 2.0 license is one of, I would say, 3 true open source licenses that you know what they are when you read them.
Yeah.
Right.
Every lawyer knows what it is. They know how to process it.
That's right. That's right. And so, there have been so many derivatives, so many companies writing an open source license, but then when you look in there, there's like, except if you use it commercially, if you get to a certain number of users, then we need to blah, 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 and it's like Apache 2.0 is just clean.
Yeah.
It's free use. Everyone can do what they want to do with it. So that's really nice. Gemma 4 apparently is crushing Gemma 3 because Gemma 3 was not very good.
Right.
And to me, it just continues to demonstrate that Google has so much optionality, right? Like, they don't have to, like Sam Altman is sweating every single thing that Anthropic does. And it's like, Google's like, meh.
Yeah.
Right.
Why don't we just give it away in open source?
That's right.
Yeah.
That's right. Yeah. Because for them, it's one of how many different product lines that they have, and what is it? Yeah. And how much cash do they have in the bank?
Yeah.
And on and on and on. Right. I mean, it's just an incredible company.
Yeah. Google's playing a 10-year game, and Anthropic, OpenAI, or playing a 3-month game. They're trying to quickly grab market share. They're both probably going to be successful, but Gemma 4 is the latest. But there's going to be an ongoing string of these where you can get intelligence largely for free. You need to pay for electricity and the server, but we're going to have a couple models running here for our use, for portfolio company uses. And I think, again, that's going to democratize intelligence. Like, everyone around the globe will be able to have these models. And it's going to be maybe 6-month lag. So there always will be a frontier, and there'll be some use cases where it's worth it. But it's great for everyone who's not at a huge company that can pay lots of money to have really strong open source. And finally, we have an American open source.
Yes. Agree. Also, Google now lets you direct avatars through prompts in its Vids app. So, I mean, I guess we can basically prompt our way through creating cartoons. Is that kind of the deal?
Yeah. So we could make 2 avatars of Vic and Marcus.
Okay.
And then have us, walking around the street on Broadway.
Okay. That's cool.
And you can have the avatars do whatever you want them to do.
Yeah, so you can prompt a cartoon, basically.
Yeah, yes, that's right.
That's cool. And then final story is kind of SaaSpocalypse Part 2, this time for the memory stock. Memory stocks have been on a run. I remember my son called me in January, my youngest son, and he was like, hey, Dad, look, and by the way, I'm so proud of my youngest son because he got off the payroll last year, and he hasn't called me back to help him pay rent or anything. It's been awesome. So very proud of you. But he called me like a little bit panicked because he hadn't asked for anything. And he was like, I don't want to ask, but I don't have enough money saved up. And I really need a new computer. Like, I've been on this computer for a while. And if I don't buy right now, these memory chips are like, the prices are getting out of control, right? And this is what was happening as AI was continuing to become more and more of a necessity. These memory chip, makers were raking in the dough.
There's a limited supply, a limited number of companies that make the memory chips, and the demand has increased, 5-8-fold, and so for several months there was a bottleneck. Like, there's more demand than they could produce, and a lot of people were worried about what would happen by the end of the year because more models are coming out and they need more and more and more memory. And what's interesting is, the Google researchers saw that and worked with AI to find a solution. So they kind of fixed it, and so that you don't have the same reliance on memory anymore with this TurboQuant breakthrough.
Yeah, now, I think we have to say it's undetermined as to whether or not this is true. This was really an announcement that came out of their research lab. And just like the Citrini research situation, the announcement alone tanked the stocks, right? Because that's how skittish the market is right now. Like, it has so little faith in the durability of cash flows. Right? That it's just like, well, who said what? Short. You know what I mean? Like, it's just incredible. It's incredible.
Yeah. And I don't know if it's going to solve the entire memory supply shortage, but after this, I have a lot more confidence that Google and others will find workarounds. I mean, and then also there's a lot of people trying to build new memory fabs. So both end will happen where we have enough supply over time.
necessity is the mother of invention.
Yeah,
and every time we get one of these situations where, oh my God, we need more of this, we need more of that, magic. And you know what? In the era of AI, those inventions are going to happen faster and faster and faster because they're no longer bound by the limits of humans.
Yeah.
Right.
Yeah,
and so, you know, you're not going to have a moat because you have some kind of corner on any market for very long. Like you'll have it for a minute, but all that's going to do is draw attention to you as a problem to solve.
Right. Which is how the economy should work. Right. Like when there's a shortage because demand is outstripping supply, either you want to have people enter the market and make more or find workarounds where you don't need that thing as much, or both. And that's a positive thing. It's not positive if you owned, you know, one of the memory stocks, but otherwise it's good for everyone else.
All right, man.
It's been a good week.
Been a good week. Happy holidays.
Yeah.
And you're going to spend some time with the family this weekend?
Yeah. Yeah. My son came home. We're hosting 8 to 10 people at our house. So I got to do a bunch of clean up and get ready things tonight and tomorrow.
Fantastic. We'll enjoy it. Well deserved, especially after, you know, starting on a Sunday.
Yeah. Yeah.
Well deserved. Enjoy it. And next week we're remote. We're not in person.
That's right.
But we will be back next week. And also hope you guys enjoy all the shows from the summit that we'll be putting out over the coming weeks.
Yeah.
All right. Bye.